Yes, in this meeting I am addressing how physicians living in low and middle income countries should conduct hematopoietic stem cell transplantation. And I make several recommendations for this particular purpose. One of them is not to try to reproduce the methods which are done in high-income countries, but develop their own methods adapted to the economies of low and middle-income countries. The salient points of these recommendations are: start with auto transplants. Do not freeze the cells. Do not start freezing laboratory because it is not strictly needed. Then move into allogeneic transplants after gaining some experience with autologous transplants, both in lymphomas and myelomas and also in autoimmune conditions. Then move into allogeneic transplants and choose non-ablative non-myeloablative preparative regimens. Once you gain expertise, you can move into another way of transplant, which is the transplant of haploidentical stem cells, which has solved the problem of not having an HLA-matched sibling donor. Since the results with haploidentical transplants are the same or even better than those of umbilical cord blood, so my recommendation is also to stay away from cord blood banks. Do not start the cord blood bank, and since importing cord blood from abroad is extremely expensive, choose the haploidentical stem cells to conduct this transplant. Other recommendations are: employ generic drugs, do not use radiation devices for the cells, and a very important one, and probably the main one, is develop your own methods, develop your own protocols, and do not try to reproduce the programs which have been successful in high-income countries.